instruction course on botulinum toxin, Part B. In this, we're going to discuss the action of various important facial muscles. Number one is the frontalis, which is a brow elevator and produces horizontal forehead lines. The next is the corrugators, which pull the eyebrows medially and produce the frown lines. The procerus and the depressor supercilii are brow depressors, produce frown line and horizontal nasal lines. And then you've got the Orbicularis Oculi, which cause brow depression and especially laterally and produce crow's feet. Here you can see the frontalis muscle, which is acting on the forehead, and you can see the horizontal lines being produced by this muscle. This actually originates at the back of the skull and it inserts into the brow, and it is actually a brow elevator. Then you've got the glabellar complex, which includes the procerus muscle, which is this blue muscle, and which would actually cause contraction and produce horizontal frown lines. The other muscle is the corrugator muscle, which originates from the nasal side, and it inserts in the middle part of the brow and actually would produce medial movement of the brow, producing vertical frown lines. So this is the corrugator producing the vertical frown lines, while the procerus will produce these horizontal frown lines. Next, you've got the Orbicularis Oculi producing these characteristics crow's feet, and this is actually the muscle which is responsible for closure of the eyelid and actual lubrication of the eyelid as well. And we need to remember that it's got three parts, which is more important. One is the orbital part, which originates from the medial canthal tendon and goes all around. So actually it is strongest at the lateral part. That is why the dosage of botulinum toxin is kept higher in this area. The other area is the pre-tarsal part of the muscle, which is actually present on the interior part of the tarsal plate, and this is the area which is used to inject the botulinum toxin at the medial part and lateral part. And then you've got the preseptal part of the orbicularis, and that is avoided for the treatment of hemifacial and blepharospasm. But if you want to produce a therapeutic ptosis, then you would inject botulinum in this part, because injection in this part would produce a ptosis, because the botulinum toxin actually passes through to the levator muscle in this area. Then you've got the nasalis muscle, which is present in this lateral part of the nose and produces these bunny lines which are present and which is used for cosmetic treatment with Botox. Then you've got the Orbicularis Oris muscle, which typically produces these smoker lines, which you see as vertical lines. And this is the muscle which we inject in cases of hemifacial spasm, but the injection sites we use are lateral part or the middle part, because the main problem, if it is used at a higher dose, it causes one-sided deviation of the lips, and the patients are not usually very happy with that. Then you've got the mentalis muscles, which produces these chin lines, and then this is present in this area, and this you use in patients with hemifacial spasm to prevent twitching of the chin in these muscles. You've got the platysma muscle, which is present over the neck, and it's got a very fine sheet, and this is used in hemifacial spasm and for cosmetic reasons, but you have to be very careful not to inject too much and not to be very near the recurrent laryngeal nerve to prevent paralysis of that nerve and prevent problems with speaking. Here you can see these are the muscles which are most important. This is the zygomaticus major muscle, and this is the zygomaticus minor muscle, which is present along with this area. You've got the buccinator or the rhizoras muscle present in this area, and you've got the platysma down here. The zygomaticus major and the major and minor muscles are present over in this area, and these are actually used in hemifacial spasm to prevent the twitching on the face. So you would target this area, and then you would target the Orbicularis Oris muscle, and then you've got the levator labii superioris oblique nasi, which lifts the lip upward. So you would inject in this muscle too for the treatment of hemifacial spasm. It's important to know the facial vasculature, so you don't inject the injection into any of the blood vessels. So the angular blood vessels are present on the medial side, And usually your injections are targeted on the eyelids or into the face, and you don't use a very long needle. So it's usually the insulin syringe, which is 30 gauge needle, which is used to puncture into the skin and inject over into the muscle. With aging, the face changes, and when the baby is born, it's like a round face and it is like an inflated beach ball in the shape, while when you grow old, you become more like a deflated beach ball because of muscular atrophy, photo damage, and fat atrophy. The appearance of a wrinkled, deflated beach ball is suspended on the inner orbital support as it is seen in this patient. In young adults, they retain much of the overall fullness of the face with minimal wrinkles, while with muscles of facial expressions can hypertrophy in adults, and predictable wrinkles seen in glabellar, lateral orbital, and nasolabial fold areas. So the types of wrinkles are very important when you're injecting Botox for cosmetic reasons, because active or kinetic lines develop through the repeated contraction of the facial muscle and seen in patients between 30 to 50 years of age. And this is the wrinkle lines which we are targeted with patients with botulinum toxin, while passive or rest lines are formed due to breakdown and remodeling of collagen in deeper dermis and subcutaneous tissue, and they need dermal fillers or chemical peels instead of treatment with botulinum toxin. Then this is the facial nerve anatomy, where you can see it comes out in front of the parotid muscle, and these are the different branches which we are targeting for the treatment of hemifacial and blepharospasm. So in conclusion, the muscle anatomy is the key to understanding the injection sites and dosages. Thank you.